Hello, welcome back to Parental Healthcare Advocacy 101 with Dr. Pace. I want to talk about something that comes up very often in our practices, especially when there's long waits. And so I want to explain what's happening in the back. Okay, so I work in urgent care. So in the urgent care environment, so this is children who maybe aren't sick enough to go to the emergency room, or you're not sure, and we're going to assess and see if they need to go, or they need clearance to go back to school after they've had a kind of a lengthy illness, or they're kind of sick and the parents aren't sure like what's going on. That's what urgent care is, right? So we're just kind of in the middle. So you're either your pediatrician sent you because they have no more sick appointments for that day. You decide to bring them in because you're like, what is going on with my child? Or you're not sure if this is sick enough to go to the emergency room, so you start with urgent care. So on the back end, as a provider in urgent care, we are asked to see patients within 15 minutes, okay? So 15 minutes is a short period of time, all right? So I just want you to just consider that. So we're asked to see patients within 15 minutes, and sometimes their diagnosis is very cut and dry. It's an ear infection. We do some teaching, we prescribe the antibiotics and give them some anticipatory guidance, and we can definitely do that within 15 minutes. However, these 15 minutes will go a lot smoother if we work together. And here are a couple ways that we can work together. Number one, when you come to urgent care, to make things move along faster for you, it's important to know if your child's insurance is active. We run into that issue a lot. And if they still need to be seen, there are, at most urgent cares, sliding scales available, or some sort of fee that you can pay out of pocket if that's possible. If not, the emergency room may be a better place for you until that insurance is active again. So that's the first thing that causes delays up at the front. Number two, we go by priority. So if someone comes in, even if you had an appointment or you have been waiting for, like 30 minutes to an hour, and a child comes in and they're having a severe allergic reaction, something with difficulty breathing, or they're an asthmatic, their priority immediately becomes more important than your child. That does not mean that your child is not important. I stress this to my patients all the time. I'm so sorry that you had to wait. However, we had an emergency. So emergencies happen. This happens in the emergency room as well. They usually have a triage system, and your priority airway is always going to be number one. Anything that's emergent that could lead to serious sequelae or disease is always going to trump whatever your child is coming in. And again, I just want to reiterate, that does not mean that your child is not sick. It does not mean that your child does not need, our care and attention. When it is your child's turn, I'm going to speak for myself. I make sure that they are, I am very sorry for the wait, but I also want them to understand that there was an emergency. So airway, breathing, circulation, any problem that a child comes in that have to do with airway, breathing, or circulation is a life-threatening emergency, even in the urgent care setting. And those children are always going to take priority over what is going on with your child. It's not anything against you, your appointment time, any of those things. But if your child had an airway, breathing, or circulatory concern, you would want us to bump every appointment to make sure that your child is going to be the same child that you brought in there, okay? Or change the child before you brought them in. All right, third. So after you have made sure that the insurance is active, and you understand that even when you check in, that if someone comes in with an airway, a breathing, or a circulatory concern, they are going to jump in front of your child. Third, when it is your turn to come into that particular patient room, our staff usually are, trained to kind of anticipate when we're kind of finishing up in another room. But just think about this. Sometimes if a child gets an ear infection for the first time, and maybe your child has had an ear infection, you may not need as much teaching as the parent who is very worried, or if they had another child that ended up with ear tubes, and they may have several other questions. So maybe we diagnose them in 15 minutes. However, the education piece to make sure that they feel comfortable when they go home may take an additional 10 minutes or so. So yes, that eats into your time. Yes, that causes delays at the front. That causes delays while you're sitting in the room. But trust me, we're coming to you, and we're happy to answer any questions that you have that are particular to that reason that you're coming in. That's the fourth thing. So sometimes we're not able to, with our time, talk about things that happened 2 or 3 years ago. It doesn't mean that those things aren't significant, and they may or may not be related to something that's going on at the particular moment. But because we only have 15 minutes, we definitely want to focus on the symptoms that have brought them in within the last couple of days, because those are the most important symptoms. Like I get this is respiratory season, kids have been sick on and off, on and off, on and off. But sometimes we can't belabor going through every illness that they've had for the past month. You can summarize and just say they have been sick on and off for the entire month. And we believe you, because we see children all the time. And we know how sick they get, especially daycare age, pre-K, those really young children. So try to summarize as quickly as possible. Another thing, if you can write down, on your way there, waiting in the lobby, what their symptoms were that you have been aware of the last several days and when they started, that definitely helps us to, when we're making our diagnosis or narrowing down their diagnosis and deciding what tests we need to order, or if we even need to order tests. So if you have time out in the lobby, just write down when the symptoms started, if there's other kids in the house sick, when their symptoms started. That will help us make the best of that 15 minutes plus. Third, I don't even know what number we're at now. Next, if your child is on medications, and if you have been giving your child over-the-counter medications, before you leave out of the house, take pictures of the medications or write the names down with the doses in your notes section. So I try to guess sometimes what medicines kids are on, but we want to make sure that if we have to order something new, that it's not going to interact with anything they're already on. So just take a quick picture. We can sound it out for you, teach you how to say it, or we'll tell you what the brand name is so it's easier to pronounce, so that you can pass that along to the next health care provider. God forbid they have to go somewhere else, so that you come in informed, okay? Also, if they have any current diagnoses, we need to know those as well. So you can tell the MA that comes in, the nurse, us, and we have to ask those questions multiple times. We understand it's a stressful situation, and some parents will say to me, you didn't talk to your other person, they didn't tell you. So here's the thing about, I'm just doing a quick aside. Here's the thing about all of our roles in the practice. We all have differing roles, and we have differing levels of education. And so they have questions that they're supposed to ask that may be because of a script, but we are also going to ask questions as well, because we are making the final decision. And if something goes wrong because we missed a diagnosis, the liability is on us. It's not on the medical assistant or the nurse. Okay, so yes, we do have to ask those questions multiple times, especially in urgent care setting, because sometimes the MA has gone off to the next room. I might not see them. I don't want delays in care. If they've put in the vital signs, yes, I'm going to ask you again that same question, and that's why. And then last, to make the best of our time together, is tell us the truth. Don't conceal diagnoses. Don't, you can just say, I don't know, and that's okay too. I've had parents say, yay, they had a hole in their heart. Now, we'll talk about this more because I am cardiac surgery trained. I worked in cardiac surgery for a long time. So it's important for me to know what your child's defect is, because hole in the heart is very vague. But write down all their diagnoses. Find a place in your notes section, take pictures of, discharge summaries if they've been in the hospital, that type of thing. They'll try to help us make the best of the 15 minutes or so that we're together, so that we can best make decisions for what's important for your child, okay? I hope that helps, so that you can understand the back end, because sometimes we're just missing information and we have to ask more questions.